Welcome back to another great Clock Talk with Dr. Greg Brannon. We're going to continue our series today on the current status of healthcare in the U.S. As always, 15 minutes of packed information. So I heard the other day there was a female in her 50s going through menopause, and she's being prescribed by her OBGYN anxiolytics. And I know you were an OBGYN for 30 years. And I know we treat a lot of patients here at Optimal Bio now that are female, that are post menopause or in menopause. Why that type of prescription for people that are going through a change in their lives at this point in time?
Let me go through real history of this. This is very interesting. What's the womb called in a woman? What's it called, the womb in a woman called? A uterus. All body parts are named in Latin by Da Vinci. When you remove them, they use the Greek name. What is the Greek name of removing a uterus?
Hysterectomy.
Hysterectomy. Why? Because I'm removing the hysteria. No joke, no kidding. We laugh at that today. But what are the antidepressants and anxiolytics for? To remove the hysteria. What's the hysteria? What's the mood changes? The lack of hormone, Jim. This is like you're driving a Ferrari, a Lamborghini, a Bugatti, some fun, amazing car, and a red light goes in your dashboard, and you take a piece of tape and put it over it so you don't have to see it anymore. Is it going to make the car run any better? No. This is root cause medicine. And what's happening is this. The number one hormone in a woman, the largest hormone in the hormone is testosterone. That's the largest hormone in her body. It's 50 times higher than insulin. We don't think about that. So picture a woman. She's born, she goes to heaven. Here's menopause. Where's usually breast cancer, dementia, osteoporosis, the bottom changing, Alzheimer's, just osteoporosis? It's here. What happened here? Lack of hormones. That's all it is. So on this side, she has testosterone, estrogen, progesterone in youthful numbers. Over here, she doesn't have any, and we call that normal aging. But there are benefits to ovulating. And even when they don't ovulate, every cell in the body has a receptor for testosterone that converts to estrogen. So the symptoms that are occurring are Band-Aid. The antidepressants do block the thermoregulatory part of the brain. So the hot flashes, Harvard did a paper 2 years ago, hot flashes are not just a nuisance. They are what's called endothelial, this pen's crazy, guys, dysfunction. So what that means is the lining of the uterus is becoming inflamed because of the lack of estrogen causing inflammation of the lining, which leads to heart attacks. It may not be a chest pain because it's not occurring yet, because atherosclerosis is not built up, but the changing of the temperature correlates with that occurring. So it's like a red light going on. So we mask that by blocking the Zoloft, by using that or Prozac or these antidepressants. Because of that, I think that's the problem, Jim. We don't go back to the root cause. The root cause is the lack of her youthful hormones. That's the issue. So when the cells don't know their age, so if a bone cell has the hormones of a 20-year-old, it's going to make bone. Bone is made, it's amazing, every millisecond. Our skeleton, we're younger, the new bones made 25% every year. And in menopause, they lose 5% of bone per year. Even men lose 0.5% per year. So that stops. So if we attacked aging as a disease, you would not wait for osteoporosis. You do whatever you possibly can to make more bone. Same thing for any tissue in your body, your brain, your heart, your stomach. Think about the brain. Women are roughly 3 times higher for dementia because they have a rapid loss of hormones. Testosterone actually makes the brain grow and make it talk. When you stop that, it shrinks. You have MRI pictures of postmenopausal women on hormones and off hormones. You could be a non-scientist and go, that one looks different than that one.
Do the typical OBGYNs that are prescribing these medicines to these menopausal patients, do they know this about testosterone?
What happened was this, if I could write this picture, not mess up here. The very first study done on hormone replacement therapy was in 1935. It was done on women who had hysterectomies, and they gave pellets of testosterone. 2002 was the famous WHI paper that said hormones cause breast cancer. 77 years of literature showed virtually no increased risk in cancer. There's a book called Estrogen Matters that goes over this paper clearly. But that they gave Premarin, which is pregnant female horse urine, and the other arm is Premarin plus Provera, a progestin. That increased breast cancer 24%. That was skewed to the older population. It was not estrogen progesterone. Dr. Fiornero in a paper in France in 2005 and 2007 had 134,000 women, and what he did was he made it easy. Estrogen bioidentical, progesterone bioidentical, estrogen and Provera. This arm decreased breast cancer 10%. This arm increased to 69%. That's a synthetic progestin. There's a difference. Dr. Glazer out of Ohio, she's a breast surgeon specialist. She has, by adding testosterone pellets, you decrease breast cancer between 40 and 60% because testosterone suppresses E2 alpha. That's the bad estrogen. So do they know this, Jim? I know they know that. But the American board said, because of the study showed, the WHI study, give hormone therapy for only 5 years because the risk gets higher with 5 years. It sure does with the synthetics, not the bioidentical. Here's my thing. I'm going to use two hormones we all know about, insulin and thyroid hormones. If you went to a doctor and he says, hey, you have 10% of your insulin level, he wouldn't say, live with it, it's normal, it's part of aging. He'd give you insulin. If you said, hey, I'm living with 10% of my thyroid, you say, oh no, there's there's retardation, there's dementia, there's eye problems, all these other issues. They would never say that. But the most abundant hormone is okay to have 10% of the dose. That's what makes no sense to me, Jim. I don't think we're not applying the biochemistry we know.
And with these, so do you think they're doing that because they know that this is a time process and eventually the body will not be menopausal anymore?
The definition, menopause is no hormones. That never ends until you go to heaven.
Okay. Yeah, but maybe the hot flashes end?
Yes, they usually about 7 years.
Okay.
But again, hot flashes are a red flag that something's going on at the endothelial level. In my new book, Restore, I have a whole section that shows women in menopause, believe it or not, have a higher risk for heart attack than men because of their rapid loss of these hormones. And the benefit of starting hormones decreases. Women have a 53% chance of having a heart attack. It doesn't go to zero. We're all going to pass this. It's pushing these diseases further down the time. That's the whole process.
Mm-hmm. Yeah, just so not to focus solely on women's health, but you heard today also there was a father of one of our PAs here, and he says having some heart issues, and they basically reduce his LDL to zero, and now he's got to go in and get a procedure done because his inflammation is getting worse. So again, are we just so overprescribed? And are the doctors today just following the script with medications as opposed to looking at the actual body and understand what's going on?
I think so, because the Mayo Clinic has a score. If you have a certain score, you go on a statin regardless. That's why I think the calcium score test is very, very, the CT of the heart. You get in a machine for 3 or 4 minutes, they'll do your score test. That shows how much calcium builds up because calcium goes where inflammation is. All right. And inflammation, again, is a carbohydrate disorder. It's an anti-fat disorder. That's the disorder that causes inflammation. It's not the cholesterol per se. Again, Ancel Keys was an economist and a fish biologist who knew in 1958, we all knew that cholesterol plaque, there's cholesterol within the plaque. But again, that's not the cause of the disease. That's a result of the body of healing itself. That's the issue. So the question is, what's the inflammation? Now, don't get me wrong. We have inflammation with aging alone. I got all that. But the number one anti-inflammatory the body makes is testosterone. The molecule called VCAM1 is a molecule that actually causes molecules to adhere to the lining of the endothelium that actually causes clotting. Testosterone is anti-VCAM1. It's also an anti-platelet plasminogen actin factor 1. It's actually forms a thing called interleukin 10, increases that, which is anti-inflammation. It inhibits interleukin 1 and TNF. All these things occur with optimal testosterone levels, not the other way around. And cholesterol forms testosterone. So statins, here's the thing. When they did the original statin study, it broke down muscle. Rhabdomyolysis was increased. And I always forget the number, but we'll say the number is 3. Anything under 3 is bad. Over 3 is bad. Well, they let it go 3 times higher. They may go to 9. But what's the largest muscle you have that's important? Is the heart. So what happens is it kills mitochondria, CoQ10. Therefore, mitochondria becomes less efficient. The muscle dies off. And we call that's okay because you're low in cholesterol. I can't stress a Japanese study enough, Jim. The data shows the higher one's cholesterol, the longer one lives, period. And it makes sense because your liver makes 2,000 to 4,000 milligrams of cholesterol every single day. And when you say these questions, do people know this? I understand that, but I can't stress a guy named Dr. David Diamond, a PhD. He has multiple videos on this showing the history of lowering cholesterol and statins in the body. And Dr. Ali Nadir has great videos and showing the same thing. There may be a place for statins. There is a component of it that may be anti-inflammatory, but if you do, you must take CoQ10 with it to stop the other things that are occurring. So that's why it's important to put all in the picture, Jim. But again, there are things you could do that are very cheap and easy, non-invasive, like the calcium score test. If you have nothing built up, you're fine. That's why the cholesterol is probably one of the most worst predictive values. We looked at studies, and there's a study at the VA, looked at 70,000 men. Men under 350 had an 80% chance of a heart attack, 41% chance of dying within 4.5 years. Much more predictive than a cholesterol level.
Men are 350, over 350 or under?
350.
So they could be at 0 and they still have an 80% chance?
No, having a heart attack. Under 350 increases heart attack.
Right.
This is not cholesterol. This is testosterone.
Got it. Okay. I'm
That's-
sorry. I thought you were
that's
talking
more-
about the calcium
That's
test.
more
Okay.
predictive. Yeah, calcium on the lowest scores possible. Yes.
Right. Okay. We kind of saw this recently too with obviously COVID in the last, 3 or 4 years where you weren't allowed to take ivermectin or vitamin D3 or what have you. And is that just the continued evolution of basically medicine becoming predictable through technology?
Here it is. I'm going to get really, really philosophical here. It's called standard of care. If the standard of care was wrong, I'll be very extreme. Standard of care was to give mercury and leeches years ago. They killed people. Maybe leeches might be better now, draining blood. But I'm saying is because somebody does this, there's a book called The Law by Frederick Batista, written in 1850. It's all about liberty. And in it, he talks about we're not against healthcare. We're not against education. He goes, we're against basically centralized government decision of this because one side does not fit all. It's been said that Thomas Jefferson said, if you allow the government to decide what foods eat or medicine to take, you have a worse state of tyranny. And I believe that, even if he didn't say that per se, is because a centralized government cannot decide out of 350 million people what's good for Jim Baker. He just can't. Jim Baker getting wise counsel, multitude of counsels to make a decision that's best for their body. But the standard of care, I understand there's a window there, and I understand that. I want that standardized of care. But things can change and things could be, it can't always be a pill, Jim. It's got to be some other things like that. And that's why it's important, because if we do these things and we do it the wrong way, and I'm going to use the example again, a low-fat, high-carbohydrate diet, you look back, dementia, PCOS, endometriosis, metabolic syndrome, all increased dramatically after that diet came in. Dr. Jason Fung in his book Obesity Code talks about, we've tried this for 50 years. Let's try something different. Okay. It's 50 years of this with failure. And you get these people. I was that person too, Jim. Go to the gym harder, work harder, eat 6 meals a day, smaller meals, high complex carbohydrates. I did it. I was diabetic. Once I learned about what fasting really was, what kind of good diet was, I lost 30 pounds in 6 weeks. My sugar went to normal in about 6 weeks. So it's important to understand that we have to understand and take responsibility for this. Don't trust what I'm saying. This is not medical advice. I hope it stirs your curiosity to always ask why. Ask why, ask questions, see the data. But again, a molecule your body makes is pretty important if your body makes it.
So again, we asked this on a previous episode, but what are some of the things a patient could do?
The most important thing is to get a diversity of opinions.
Watch your YouTube videos.
Watch your YouTube videos, Dr. Sean Baker's videos, Jason Fung's videos, Ali Nadir's videos. They're out there. I think the internet, the Instagram, the videos of doctors and nutritionists out there is a plethora of information. If a doctor says don't go Google, change doctors. You're trying to tell me everything I learned in 4 years of medical school will apply 30 years later is ignorance or arrogance.
As always, 15 minutes of information with Dr. Greg Brennan.